Over the past 2 days, we have heard about alpha-gal syndrome and how it affects people. In the last episode of the AGS series, our Megan Marshall talked with lawmakers to learn about what is being done to raise awareness for this emerging health challenge. Megan.
Many people go undiagnosed and untreated for alpha-gal syndrome, a life-threatening allergic condition. In a study by the CDC, fewer than 1/3 of doctors knew how to diagnose the condition. The limited awareness and knowledge of AGS leaves the true number of AGS patients unknown. I spoke with doctors and West Virginia lawmakers to see what's being done to raise awareness for this emerging healthcare challenge.
The Centers for Disease Control and Prevention defines a nationally notifiable disease as one that, when diagnosed, requires health providers to report to state or local public health officials. This system is in place for the purpose of monitoring, controlling, and preventing the occurrence and spread of diseases. Currently, alpha-gal syndrome is not a nationally notifiable disease. West Virginia Delegate Kathy Hess-Krause is working to change that at the local level.
When session comes about, I will be sponsoring a bill. One of the diseases that doctors will have to report to the health department and to the CDC would be alpha-gal, so we can get some better numbers.
She hopes the bill will bring accurate reporting and data collection of AGS in order to develop targeted public health interventions, better treatments, and maybe a cure.
Not knowing how many people have it, many people it takes a year, 2 years, even 5 or 10 years, before they find out they have it because they're not putting it together. So I'm hoping to make this a reportable disease to the CDC, which they already have a database set up, and only about a handful of states report to them right now. I'm hoping that that will expand our knowledge.
She says making AGS reportable in West Virginia is a proactive approach that will protect the health of all West Virginians. Another approach that could be beneficial is allergen labeling for AGS. Doctors and people with the allergy say this would make knowing what to eat easier.
What's more important really is the idea of labeling. Patients are really struggling to figure out if the food that they're going to eat even has mammal products.
We need something that says alpha-gal safe because we've got so many other considerations besides the meats and the dairy.
One of the bigger frustrations is labeling on foods. There are so many mammal byproducts put in our foods, even when you wouldn't think that there would be any. It's extremely difficult to watch what you're eating if you don't know what all is in it.
The best strategy right now for everyone against AGS is tick bite prevention. Tick exposure happens year-round according to the CDC, and unlike other ticks, the Lone Star tick is an aggressive human-biting tick.
It's important for healthcare providers to also educate their patients on how to protect themselves against tick bites. So not just doing tick bite checks after they've been in an area where they know there are ticks, but taking action to prevent the bite altogether.
Dr. Common says people with AGS could slowly recover from the allergy.
The caveat is if you get more bites, tick bites, or bee or wasp stings even, the number spikes back up, and then it prolongs that. If you get a tick bite probably every other year, that's probably frequent enough that it's going to keep it around.
The CDC website lists other precautionary methods against tick bites, such as wearing permethrin-treated clothing and using bug repellent.
Thank you for tuning in to this last part on the alpha-gal syndrome series. Back to you.
Thank you, Megan. You can read more about the last part of this series by heading over to WTAP.com.